don't know how to follow that. Dr. Hordhoff, it's clear to most of you, is just an absolutely remarkable human being. He's also, despite the fact that he looks so young, has been part of the Columbia faculty for over 40 years now. Dr. Hordhoff began his training at what was then called the Babies Hospital, now Morgan Stanley Children's Hospital, in 1970. Many of you in the audience were born in 1970. He, following training at the Babies Hospital, served for 2 years in the U.S. Army, and then returned to Columbia, where he undertook his pediatric cardiology training. Completing that in 1974, he joined the faculty and has been with us in that role since 1974. Over that very long and illustrious career, he's been synonymous with leadership in the division, serving in many different roles. And we're really grateful for his years of service to Columbia. Perhaps more important than his service to Columbia has been his passion and service to the children that have benefited from his incredible skills. The other thing that's important to point out is that in addition to being an outstanding clinician, the man is an incredible educator and role model. And it's hard to imagine that over 100 young pediatric cardiologists have trained under Dr. Hordhoff. So it gives me real pleasure to ask you to join me now to enjoy watching this really well-deserved tribute for a wonderful doctor, a remarkable colleague, and just a remarkable human being, Alan Hordhoff.
We love Alan Hordhoff. You know, he's been there the whole time that we've been going there. Always making us feel comfortable. Alan's been the backbone of that organization for so many years.
There are two qualities of Alan Hordhoff that make him an exceptional role model for our young trainees. One is his commitment to the patient. That's first and foremost with Alan. The second quality is that of loyalty to the program. He has a real commitment to Columbia, to his colleagues in pediatrics and pediatric cardiology.
You know, he seems like this sort of gruff guy, very old-fashioned with the mustache and the glasses, but when he's at the bedside, he can relate to kids of all ages, and he really gets through to them. And it's not just patients and kids. The way he interacts with the other doctors and attendings and fellows and residents here, he just has a knack for working with people.
I feel like as fellowship has gone on, he has continued to be an excellent resource. And when you have a difficult, challenging case or something, you know, hemodynamics that you don't understand, you can always go find him and knock on his office and ask for his help. He's always there to help.
The gift that he has with talking to families and making them feel better. I mean, you can't learn that. I don't think you can learn that anywhere. I think us being around him helps us to understand how to be that person, but certainly I couldn't have picked up a book to learn that.
Everything he says has meaning to it. He doesn't waste his breath with anything. And because of that, we've all become better cardiologists, we've become better doctors, and ultimately better people because we know him.
Not many people are that dedicated here. He's dedicated to pediatric cardiology beyond the norm, and then he's very dedicated to the Civil War. That's interesting. A lot of people don't have those passions in life.
It's just a pleasure to discuss a case with him because he has such a trove of experience that he can sort of bring forth and use to you know, help you deal with a case. So I think people like Alan are just spectacular.
A great honor to me that toward the end of his career that I'm able to participate in moving Columbia ahead into the next generation and working with him to do that.
I've been very lucky throughout my career to work with tremendous people. I've had the support of my family, and particularly a very special person who I met first in 1972 when I was a pediatric cardiology fellow, and she was a staff nurse in the intensive care unit. In 1974, I became director of the pediatric intensive care unit, and she became the head nurse of the intensive care unit. Interesting story. And since 1976, we've been partners of life, and that's my wife, Carol.
Alan, I don't know how they got a picture of your great-grandfather, but I do know that Carol did take away your gun to shoot the television during the Giant games. So now that you're calmer, would you please come up here, please? Crying, so please sit down. Before he speaks, I want to present him with this Baccarat heart, which is inscribed Alan J. Kordoff, MD, clinician, teacher, pediatric cardiology, CMC 2012. Alan has now promised to beat our favorite president, his and mine, Abraham Lincoln, who gave the Gettysburg Address in 2.5 minutes. And so at this point, I'd like to turn it over to Alan.
Thank you all very much. This is quite an evening. I'm not used to this.